So today we're going to start talking about some physical therapy aspects in the golf swing. So we're going to put the clubs away and we're going to talk about the most important thing, which is your body. I'm sure you have heard a lot of people talk about TPI. You've definitely heard me talk about it. You've heard a lot about exercises and things like that. But today I'm going to show you two of my favorite things that we check in TPI. These exercises that I make people run through in these screens are very important because they let me have information that I otherwise wouldn't have about how to teach you and about why you do certain things. There's a lot of stuff out there about shallowing the golf club. Today we're going to talk about it from an angle that I'm sure you have not heard yet, most likely. So one of the things I like to check is I get people in a nice standing posture here with chest up. I have them put their arm on a bookshelf here. So the upper arm is at a 90-degree angle to my shoulder, and the forearm is at a 90-degree angle to that. Well, the first one's a 180-degree angle. Don't hate on me, math people. Stand up nice and tall. We're going to rotate this backwards just like that. Now you're going to see a lot of people who will get in this posture and get right there and then use their back to take it the rest of the way to try to get it back further. That's an immediate fail. We are checking for how far you can get that arm backwards. So we do it in standing posture first. This way. Good. That actually is a very important component to shallowing. If you cannot get your arm here in the downswing, you're in trouble. You're going to do this, which is that over the top movement. So one of the ways that I check for that immediately is I have them do it standing up first, and if they pass here, which this is passing because it's spine angle, I have them do it in golf posture. So once they get to golf posture here, same thing, arm on a bookshelf, rotate it backwards. If they can get all the way to there, it's perfectly fine. Most people cannot. It's a really good way to check and see if your arm and shoulder are capable of shallowing the club properly. If you get into golf posture here and you get to here, chances are this is what you're going to look like at the top of the backswing, which means you're going to do this as opposed to this, which is literally the difference when coming over the top and shallowing. I would absolutely really pay attention to getting that better before you try and change something in your swing, because if your body is not capable of it, it's never going to happen. The second thing is a drill where I have them put their feet away from the wall here, put their butt against it. I have them lean all the way off the wall, kind of slunched forward, and then slowly put every one of their vertebrae against the wall. A lot of people I see can't get their head against the wall. They're here. That's definitely something I would have our physical therapy team or somebody talk to you about if that's you, but we really want to see this all the way against the wall. From this position, I have them stick their arms straight out, thumbs up, and then take the thumbs to the wall behind them. Most people, when they get to here, will arch their back off the wall, and that is a fail too. But this is checking the lat stretching ability and the flexibility in the shoulders as well. If you have a problem doing this drill, once more, you're going to have a problem getting the club to a good position in the backswing and a problem shallowing it. So that is a different way for y'all to think about the mechanics of the golf swing and what your body needs to be capable of before you're capable of it.